We're very excited to have Alfred Johnson with us today. Um, and I'm I'm just really excited to hear this presentation. So as people are trickling in, I'll just let you know a little bit about Alfred's background. So excuse me, I'm looking at some notes over here. Alfred's background includes skilled nursing facilities, hospitals, intermediate care facilities for individuals with intellectual disabilities, emergency preparedness, response and recover, child welfare, mental health centers, assisted living facilities, and other community-based services. So Alfred has worked for the Division of Quality Assurance since 2001 and has served as the Division of Quality in a variety of roles: surveyor, regional director, director of the Bureau of Technology, licensing and education, director of the Bureau of Assisted Living, and currently the Deputy Division Administrator. While in DQA, Alfred has been instrumental in establishing collaborative statewide and nationwide working relationships with counties, care management organizations, regulators, advocates, research scientists, and industry representatives to help improve the quality of care in assisted living, childcare, and child welfare settings. So not only all of that, but Alfred served as the board president of the National Association of Regulatory Administration from 2021 to 23. He also serves as secretary for MIPA, for Midwest Injury Prevention Alliance, and he chairs the Older Adult Falls Committee. He also serves as chair for the National Group Quality Assisted Living Collaborative. And Alfred enjoys coaching sports, spending time with family and close friends, and living by the wise words: be kind, compassionate, and forgiving to each other. So, with that, I hope that you all help me welcome Alfred Johnson. And we are going to have some time, hopefully at the end, for questions, but you can put that in the chat along the way, and I'll be monitoring that and helping to respond to those things. And we have until 2 o'clock, so we're really grateful you're all here. So with that, I'll turn it over to Alfred.
All right. Well, good afternoon, everyone, and thanks for having me today. Today, we were planning on having a featured speaker from AMDA to talk a little bit about response to falls. Dr. Hanowitz was unable to join us, so I am filling in today. And one of the things that I want to speak to you today is more of this growing industry within our country and around the world. It's speaking to assisted living. And I'm going to relate this to the rise in acuity, going to talk a little bit more about falls that are occurring, and talk about what we call a framework for quality. And because so many of our citizens are living or choosing this sector of work, it touches all of our lives. As Heather mentioned, I work primarily for the state of Wisconsin in the regulatory field. So part of the system that goes into assisted living, nursing homes, hospitals, and those, when they say the states here, it's folks like me and folks that I work with that attend those. But also outside of that, I work with assisted living regulators, providers, researchers, you name it, to really help understand what is going on in assisted living and how to improve the quality of life and ultimately the quality of care in those settings. So I'm going to share my screen with you and share a very unique program that we have out here in the state of Wisconsin. So if you hear this term, WCCEAL, WCCEAL, so think of that, WCCEAL, WCCEAL, that stands for Wisconsin Coalition for Collaborative Excellence in Assisted Living. In the United States, there are more than 1.5 million people who are choosing to live in assisted living. Assisted living can be defined as a very small home or small group home serving people with intellectual disabilities. It also may, you look at a home that has individuals, older adults or people with mental health issues or whatever it may be. So assisted living is growing significantly. It's where people are choosing. It's a very home-like setting. But as folks are choosing that type of setting, those folks are presenting with a certain level of needs, be it healthcare, be it behavioral health, falls, rehospitalizations. All of those are areas that are really striking this sector of our country. And we have a great opportunity to help modernize, help move the services and care that's being provided there, not to mimic or duplicate what we do on the nursing home side, but to say this person has a right to live in this home-like environment, but how can you provide the level of care that the person needs? So WCCEAL is a great opportunity that involves what we call a public-private partnership, a public-private partnership. So the government at the state, local level, and those outside of the government, be it providers, be it researchers, be it practitioners, be it advocates, the consumer, those working together. In Wisconsin, about 15 years ago, we started WCCEAL. So 15 years of incredible work to move towards quality. So part of this, we're going to share a little bit about the history and overview, how the program works. I'm going to share some perspectives from a regulatory, Medicaid, research, and national, and then talk about this framework for quality. I hope to have some time for a conversation with you if you have questions. So next, I'm going to show a video. So bear with me.
The Wisconsin Coalition for Collaborative Excellence in Assisted Living. And it's all about that collaborative aspect.
It's one of a kind in the country. There's nothing like it. And now other states are seeing the successes.
It's a great collaboration between associations, providers, the Medicaid program, and also our Division of Quality Assurance.
All of those different stakeholders coming together to say, we care about assisted living residents having the best possible quality of care, the best possible quality of life, and not only are we going to be content with compliance to the minimum regulations that the state has for this industry, we want to continuously improve.
As we see more and more funding going towards assisted living, there's going to be constant pressure from federal Centers for Medicare and Medicaid, from state legislatures to understand what is the value that we're purchasing through our program. I think WCCEAL is being highlighted nationally as a program that can improve quality without increasing the regulatory burden upon assisted living facilities.
We're doing it because we care, not because we have to. It's let's be proactive and rather than reactive, and let's provide the best resources we can for our providers. At the end of the day, it's hard work, and we want to make sure that the staff, the frontline staff, has tools, the leadership has tools, and WCCEAL really does a great job in providing those resources.
In 2009, Kevin Coughlin came to me to discuss the possibility of creating something like WCCEAL. We realized that to have a quality improvement program, you really needed to have some standardized data and some standardized measures for things. And so we put together a plan to do that.
So often you think you're doing a good job or you don't think you're doing a good job, and being able to see yourself compared to others as well as compared to yourself makes a big difference in improvement.
WCCEAL is a powerful resource to improve the quality of assisted living facilities, and it allows assisted living facilities to compare their quality to their peers in a confidential, safe space.
It's not about putting in your data and ranking ALCs against each other. It's about everyone growing together.
If you would imagine with me a cycle that has 4 components, we are going to assess how we're doing, we're going to monitor or get feedback on how we're doing, we're going to take some action, and in WCCEAL, the way that action takes place is by having support from the associations and coaching, and then taking all of that in and adapting. The reason why that is so powerful is that right now there are 400 other assisted living providers who are also submitting their data, which means that I can go in and get feedback on specifically what aspects of my data are important for me to drive action from.
You can compare yourself and say, wow, 59% of the WCCEAL population is using this thing that I've never heard of. Maybe I should learn about it. That information is then also available on the WCCEAL website so that you can learn about these things and grow as an ALC as well.
People can call other members and ask questions and support one another. And that's a real benefit in itself. From data comes good outcomes, and from the outcomes, how you can improve your quality of life and care.
Participating in WCCEAL is easier than you think. We've found that the majority of the ALCs, it takes about 5 minutes a quarter. The satisfaction survey is a yearly thing. The ALC needs to take the time to hand out the survey to the residents and encourage them to return it. And that really is all the actions that an ALC has to do in the WCCEAL system to participate.
The best resource to know how someone's doing is ask the resident. Make sure that are their needs being met? Are they happy here? It really was beneficial for the providers to see, oh my goodness, we've had great surveys. Or if we haven't had a good survey, this is the area that we need to improve in.
A new benefit of WCCEAL is also access to the Clinical Resource Center. Along with all of the resources on the Clinical Resource Center, anyone accessing it also has access to the AMDA clinical practice guidelines.
And it's our responsibility as WCCEAL, as a program, as a statewide program, as well as with the associations, to really talk to the members, to really let them know that this resource is available.
In the future, it's my hope as the administrator of the long-term care benefits in the Medicaid program that we will be able to let consumers know which assisted living facilities are in WCCEAL.
You shine above the rest when you are a member of WCCEAL because you've taken on that extra responsibility, collecting data, you've invested in your staff, and ultimately who benefits but the resident.
WCCEAL, the Wisconsin Coalition for Collaborative Excellence in Assisted Living. Visit.
That's a well done video, wouldn't you say? So as you think of the WCCEAL program, it speaks a lot about internal quality improvement. So the concept and the reasons why we talk about internal quality improvement, I said at the onset, more than 1.5 million people are living and choosing assisted living across our nation. It's the fastest growing sector. Those individuals are going in and out of the hospital. Some are going to nursing homes for short-term rehab, but many individuals are returning back to those settings that are their homes, and people are living longer. So the idea that quality and ensuring not just a regulatory set of standards saying you must adhere to these, but empowering, engaging the assisted living community with the rest of the industry, be it hospitals, nursing homes, other folks, the evidence-based practices to really help them strive towards quality. So within the WCCEAL system, there are what they call QI variables. So there are things that they report on a regular basis, and they're able to utilize. You heard Susan and Edmund in that video speak to some resources that they have. So they have the most current evidence-based or peer-reviewed practices that are out there to help not only track what they're doing, but also improve of what they're doing. And I love Heather, who you saw with the smile there. She was our state ombudsman, who speaks to, at the end, the resident excels or wins. So quality is a key component. Within the way it's framed, the Department of Health Services, which I work for, our colleagues over in the Division of Medicaid Services and the regulatory part, we're supporting this, fully supporting it. We're engaged with from an administrative side. There's also some money that's been shared to help get the program going and keep it going for 15 years. So there's a lot of involvement at the department level and a true partnership between the Medicaid and the regulatory side. We have a strong academic partner here in Wisconsin. We have the University of Wisconsin-Madison, and they do the administrative work with that website and all of the work and being able to pull reports that are real-time data for the provider community. And then here's the unique thing. I talk about the Department of Health Services engage. We see the university engaged. But more importantly, if this was sitting around the table, and I apologize that I thought I disabled this to, it may keep popping up, these notifications, but sitting around the table are providers, trade associations, advocates, clinical professionals, directors of nursing, you name it. Everyone's around the table. And as this piece of a puzzle that you see, everyone's contributing. No one has a weighted vote. No one has any of that. Everyone is contributing to not only the conversation, but to the development of the program. It's been a true partnership, a true collaborative working relationship to have everyone at the table working together, contributing, pushing, and striving to make quality a reality in the state of Wisconsin. So as I mentioned, these are a representation of some of those entities, be it the trade associations you see listed there, Leading Age and RSA, WALA, and this department. So I will share this, there's some guiding values that are there that speaks to transparency, communication, integrity, because internal quality improvement, you don't necessarily have a variety of different people auditing your records and things. There's a level of trust and integrity with that. So some good values that have been placed there. And then here's something. Back in 2011, we had 107 assisted living communities to be part of WCCEAL. As of right now, we have almost 600 assisted living communities in Wisconsin that are part of that. And it's growing, not growing where everyone is currently part of it, but it's growing and it's sustainable. So as those assisted living communities join, they are joining and they are finding themselves in WCCEAL as such as that internal quality improvement and some of those aspects. And one of the big areas that we'll get to is falls prevention and responding to falls. And I'll share a little bit about a study that was done. So Atman, there's a video that you'll be able to view. I'm not going to take time to have you view it, but there's a video that really speaks to the mechanics of it. And I'll just share with you briefly how that works. every assisted living community has access to a website. The website allows them to report information, to extract information, to run reports. They can do comparison. And as I mentioned, like with falls or different things, they're able to pull information out and they can track and say, hey, we're seeking to have improvement in the number of falls that have occurred or falls with injury. And they're able to track that in there. They also are able to do some assessments and some analysis. They work with their the trade associations or other entities to help pull together some best practices to to assist them in changing the culture or the work within their areas. And this is done without, so you're going to hear me as a regulator say this is done without us, the state of Wisconsin, issuing a fine or a forfeiture or a department order. The provider is taking it upon themselves to capture the issues, deal with the issues, and prevent future occurrences along the way. And with that, they're able to see for themselves. I can't see, there's a firewall between the data. I can't see what they develop and what they put together. What I see, if I'm state regulator coming out to the setting, I see the end result, better care. See, boy, a fall did occur. Now they put things in place, interventions and other things in place to prevent future occurrences or to reduce the risks that are there. So it's a great program, has a great website. And like I said, that AMDA and the clinical resource centers are excellent tools that folks can use. There's been some national awards given to this program. You'll see from 2015, the Harvard Innovation and American Award, the Association for Healthcare Facility Surveys, Pioneer, CMS approval. We even have, back in 2019, started a pay for performance. So as providers are doing good work and hitting some metrics, they're able to have a little incentive to pay for the work that they're doing. So you'll see this video that goes really dive in deep. This equality data system is that electronic system that I reference, and we'll share this with you for you to look a little bit closer at that. But I just want to share speak of when you ask why should I participate in this program? From a regulatory perspective, when providers are invested in internal quality improvement, so for MIPA's purposes, we talk about injury prevention. Injury prevention, I chair the Older Adult Falls Committee, so a small plug. If you want to be part of that, please go to our website. You can click on the interest there. We're going to restart those beginning in 25. So it'll be a great opportunity to network with other professionals as it relates to older adult falls. But regulatory compliance, falls are one of the bigger issues that we're seeing here in not only Wisconsin, but around the country. Falls that have changed a person's life. So that person who was ambulatory is no longer ambulatory. And if that setting is not ADA accessible, that person loses their home and has to go to another place. We also are seeing ongoing issues with complaints and other types of things. A provider involved in this WCCEAL program is able to invest into those issues with whether it be resident satisfaction, be it medication administration, whatever the topic may be, they get an opportunity to trend and track issues. And hopefully at the end of the day, we see less regulatory violations. But more importantly than that, we're able to see an increase in the quality of care, that person-centered approach of truly looking at what that individual needs and being able to treat and care for that individual within that setting and helping them and improve their capabilities and capacity to meet the needs of those that come through those doors, we're seeing a higher quality of care. We use this term here about raising the bar. We see a higher quality of care, higher attention to the actual needs of that individual. So in return, that person who's living longer is living longer with a higher quality of life instead of being confined to a wheelchair or something like that because of an injury. They're putting things in place to meet the needs. And then the other thing I like is this shared vision. So there's a shared vision from a regulatory perspective, a provider perspective, an advocate perspective, a funder, a practitioner. We all want the same thing for that person's needs to be met. So from a regulatory perspective, we definitely want regulatory compliance. We want to see that quality of care, but through that, this shared vision really comes alive. And it's really evident within the WCCEAL program. This is the slide that I wanted to share with you that shows Dr. David Zimmerman, UW-Madison here in Wisconsin, was awarded some grant work to evaluate the effectiveness of evidence-based falls program for assisted living communities. So those key activities were evaluating those evidence-based practices, encourage the assisted living centers or communities to adopt a plan, not any plan, but to adopt a plan and to tailor it, to their center or to their community. And then this comparison, this QI variables comparison report was able to pull things in. And it's interesting, one of the bullet points that you see there, 57% of the survey did not have a falls prevention program. Think about that. 57% of the survey respondents did not have a falls prevention program. If you look at that across our country, it's common in assisted living to have assisted living communities think of themselves as a social model. But if you look at that video that we had, if you had patients or residents or family members living in assisted living, some people have said assisted living today is the nursing homes, at least the residents are the nursing home residents of yesteryear. So those people are presenting with chronic diseases and all kinds of different things. So they are requiring, and matter of fact, expecting care, treatment, and services. So 57% of those settings did not have a fall prevention program. As a result of some of the work that was done here, there was a larger percentage of that 57% that they just did not adopt a fall preventions program. And they didn't do it because of regulatory compliance, or they didn't do it solely to prevent themselves from being sued or lawsuits or claims, insurance claims. They did it for that quality of care component. So adopting, implementing, tracking, and improving, continuous improvement. That's what WCCEAL, the Wisconsin Coalition for Collaborative Excellence in Assisted Living, does. It allows for not only adoption and that true sense of every word, the true implementation, person-centered, and then you can track and trend, and then you have the resources around to help you. So you don't need a fine from the state of Wisconsin or the state of Michigan or Iowa to encourage you. You do it yourself because it's the right thing to be done. So you'll see when we share this, you'll be able to see a report that speaks to some of the work that was done there. And then from our funding perspective, there's some scorecards and other things that Wisconsin was able to put into place And it showed like the AARP scorecard, Wisconsin ranked third in the country. And then the piece that I had mentioned regarding the pay for performance, which was an incentive and more of a pilot program of looking at how to incentivize the provider community to not only participate in the program, but see tangible results from the program. So that's been shown to be a success. And then in Wisconsin, as well as other states, you see the concept of family care. So we have what we call managed care organizations. So the WCCEAL program, meeting with them, engaging with them, they're actually using the WCCEAL provider list as a provider of choice. So when you're looking at this quality, it's just not the regulatory piece, but you're also looking at these tried and true methods to evaluate a provider and to see longevity, that they're getting the most out of that public money that's going into AL to meet the needs of the individuals. Research. So if Susan was here, she would share some data with you, but it's data rich, 15 years of data that has never been collected on assisted living. And it's good, rich data that helps not only frame public policy, but also shows that when providers invest into internal quality improvement, there's a significant change and improvement that we see. And you see the one component of this slide, falls prevention and falls. You're seeing a change in those environments. Someone would ask a question, are all falls preventable? And if they're not, what do you do? If Dr. Hanowitz was here, he would speak to what happens as a result of a fall. He would also speak to, if you had a medical director or a physician, where would that physician play in? What role does the physician play? Is it more than just notifying the doctor, the primary care physician, that Alfred fell today? Is it involving a clinician in the assessment, not only of that individual, but of that environment? What more is there to be done? And that's the piece that I believe WCCEAL is part of the solution. It's not the solution, but it's part of the solution at helping providers. So in the state of Wisconsin, we have almost 600 providers that are engaged on a day in and day out basis on falls prevention, on resident satisfaction, immunizations, and infections, really looking at that. We have a lot to learn continuously from the pandemic. WCCEAL is a vehicle that's helping the provider community connect with public health and others to really examine and how to do this, not strictly just through updating regulations. So there are some publications that you'll see listed there, some large-scale data-driven quality improvement, using computer tablets. Falls prevention is that stuff that I referenced from Dr. Zimmerman, and then improving federal oversight in the Medicaid world. And then just a couple of quick things on a national perspective. When you think of assisted living in our country, we are part of what it's called a Quality Assisted Living Collaborative. If you Google that or do an internet search, you'll see that we recently published some information on infection prevention and control. Falls and injury prevention and those things are part of that. Our large goal is developing assisted living model standards. It's an opportunity, and we would love to engage with you that are attending today and you that may listen to this in the future. If you want to be part of the collaborative, be part of one of the work groups that are developing strategies, be part of the solution, this is a great opportunity for you. All you have to do is you can reach out to me. I'll put we'll have my email address available to you, and we will put you on that list. And as we develop things right now, that Assisted Living Collaborative is working on emergency preparedness and dementia. And those standards are going to go out, and they're not going to do this. If you listen to this, there won't be just on a website that will collect virtual dust. We talk about adoption, having an actual plan, and building a relationship with people like you to really work through the issues that we're seeing, so that if standards or if guidance is put out there, that we actively work to implement, to adopt. And then the same way that you look at this system, WCCEAL, looking at helping states or provinces to implement, to track, and to do it, not just to do it just because the regulators or the government is telling you to do it, but you're doing it because it's the right thing to be done. So the Quality Assisted Living Collaborative, the Assisted Living Model Standards are a big goal of that. So if you're interested, all you have to do is email me. I'll include you in, and as the group is working, we'll connect you that way. So this is a time for some questions and conversation. I want to just, again, thank you for the opportunity to share this information. I know it was not Dr. Hanowitz's presentation, but I believe, given assisted living's position in our country and how our citizens are using assisted living, I figured I could share this with you as a very innovative model, and also share a connection point with you, be it the older adult committee, or the QALC, which is the Quality Assisted Living Collaborative. So I'm going to stop sharing, and I see there may be some questions in the chat.
Yes, thank you so much, Alfred. That was such great information. I did put a couple of things in the chat for folks, as well as your email. But it looks like Heather Phillips, can you put your question in the chat, please? And anyone else who has questions, please put it in the chat so we can respond. Well, she had her hand up, so I'm not sure what, what happened. Yeah. Maybe she's typing.
Yeah, that could be it. Yeah. So it's a great, Heather, as you're typing and folks are thinking of this, a partnership with you. And that's what I really want to share, the ability to partner with you to help, especially this sector, this assisted living sector, which, like I said, touches so many people within our country. So it's a growing sector, but a sector that is maturing before our eyes. And if we can help it mature in the right way without being overly regulated and overly prescriptive, because of that concept of person-centered planning, would be ideal.
Mm-hmm. I have a question while people are still typing, hopefully, and asking questions. Is Wisconsin, have you seen that type of model where assisted living centers are opting in to have that data from residents? Are you seeing that in any other states? Like, I know I'm in Minnesota, and I don't think we have anything like that. I think we have a place for complaints, but I don't think there's actual one central place where facilities are opting in. Are you aware of anything?
No. So the WCCEAL program is the only of its kind for assisted living in the United States. In New Jersey, there was a program called Advancing States or Advancing Standing. I believe that may be either tailoring or it's not currently going. North Carolina is pulling together some information, something similar to that. They're at the very early stages of that.
Incredible. Okay, there are a couple questions in the chat. Can you see it, Alfred, or would you like me to read them to you?
Yes, I can see it here. It says, do you know what made up the fall prevention programs for those who had them within their assisted living programs? Carrie, I do not know that particulars. I think I would have to pull that apart a little bit, and I can have a talk back with Kevin and Susan to pull that information. Carrie, if you would send me an email, I can look to respond to you outside of this. And then, are there any plans to expand this programming to a regional level? Yes. Yes, there is. So we've been in communication with multiple states and areas. What we need to find is willing partners. And the concept here, Ali, as I'll mention to you, there are two things. We want to start it. So having the courage and the bandwidth to start it, but also having the perseverance to see it through. Because those 15 years, there's been some tears. There's been some hills and valleys because it's not something that is very simple to get done. So, in your state or jurisdiction, if you're interested in even engaging in dialogue, we will do it. There's no cost to engage in dialogue. And I think the cost to expand, if we can get the state, the Medicaid folks or the regulators or others, public health, to consider some money to help expand it. I think that's the only thing that sometimes draws people back, is not as a little bit of the money, but then more of the time and energy that it takes to build the collaborative working relationship. But we would love to join wherever you're from to look to do this.
Thank you. Are there any other questions from folks? We have a couple minutes left. I have another question while people are thinking. What do you think it's, I've just been very curious about this. Just maybe it's because I'm turning 50, but how do you think things are going to change as Gen X ages and starts being part of these communities? They seem so different right now than anything that Gen X would want to be part of. So what do you and the experts think about that? Oh, you're muted.
First of all, they would be better with technology than I am, but more importantly, because assisted living is the foundational value of person-centered or resident-centered care, that means that that individual has control over the environment, the services, the programming, all of that. So you even see today a drastic change and the look of some. So in some generations, they did the concept of neighborhoods. And you had this old retro look of things, and it was familiar to people. You're starting to see more use of technology. And technology, not just the concept of cameras or that, but I was in a setting recently where I thought I saw something run past me, and I thought maybe I'm hoping that wasn't a mouse or something, but it came past me fairly quick. And when it poked its head, came out of the room, it was robots, these robotic pets. And the pets were hugging the walls, so they weren't like a tripping hazard. But the pet would, if you got close, it was like motion centered sense, and it stopped, and it would get up into your lap, so you could pet it, and it would just sit there and purr. And then they had other things. I was in a setting where they had a robot. So if you've been out to eat and you've seen the robots come up, but they actually had robots and things there. I've even seen with the younger generation, when I think of assisted living, it's not just older adults. It's sometimes, a person who's had a stroke or something, and they can't live at home anymore. So even the design of the home just looks completely different. So there's a lot of changes there, and that's the unique nature. And if I can just share this again, the reasons why we are all in with a program like WCCEAL, we're all in with the Quality Assisted Living Collaborative. We do not need to turn assisted living into the nursing home. We don't need a bunch of regulations that prescribe that you must do this and you must do that. Heather, for example, some people like to eat pancakes for dinner. And some people sleep part of the day and up at night. Some people are not stationary. When you think of the new generation, some people may still be able to maintain their driver's license, may be able to have relationships. And when we say relationships that are not just what people would consider a traditional relationship. A relationship, people may, if you think of your home and you come back to your home and it's truly your home, you're able to let your hair down and be yourself. That new environment and the continuous improvement that's happening in especially assisted living needs to continuously embrace that. I can't put on a facade or airs. This is my home. I'm going to be myself, and the home is going to have to adopt or adapt to that. So I think that's where you're going to see the change continuously happen.
Well, Alfred, thank you so much for your time today and your expertise and for pivoting right at the last minute and
Yeah.
such a great presentation. And if anybody would like to reach out to Alfred directly, you can do that. And now we're going to wrap up this session and head back to the closing keynote presentation. So thanks again, and we'll see you soon.
Thank you. Take care.